topic that we discussed today is arthritis. There are many forms of arthritis, but it is important to understand what it is first. Simply, the word arthro means joint and itis means inflammation. So arthritis relates to the inflammation of joints and is a term that is commonly used to describe any pain or issue in the joints. There are a few common signs and symptoms that can indicate if you have arthritis. The symptoms that are mostly associated with arthritis in the joints are aches, inflammation, and a stiffness in the joints. Other symptoms that can occur are changes in weight, trouble with breathing, fever, and not being able to complete everyday movement. It is important to remember there are many kinds of arthritis, but these seem to be the most common symptoms associated with them. These different kinds of arthritis also have similar ways that they are developed. It is through past injuries, issues with the immune system, family genetics, age, and a decrease in hormones. Overall, it is important to understand that arthritis is common and to talk to your doctor for ways to improve this condition.
How can arthritis affect a person's daily routine, and what does a person with arthritis go through? A person diagnosed with arthritis are basically limited to do normal activities that can cause stress on their body, leading them into depression and feeling like life is challenging. As referring back to the types of arthritis, such as rheumatoid, individual does an activity, they will experience pain. So when they do going for walks, going up the stairs, kneeling down, grabbing on something, or as gripping, reaching for something, doing housework, cleaning, chores, and then also social activities. So doing those type of activities can cause stress onto their body. When a person does go for a walk, they will experience pain for that. So it comes to the point where they won't be stable enough to walk on their own. So they will have doctors providing or recommending to use like wheelchairs, canes, walkers, or motor scooters, for they believe that would be best for them to have assistance. So we'll have difference of like areas of what they will feel discomfort. So as like for the knee, the foot, hip, or the back, they will be limited of, independence when going upstairs because they're at the high risk of losing their balance as well in this activity and falling down. As for someone's like usual routine that requires a lot of bending or stooping, it could be hard for them because of how much the pressure they are putting on their knees when grabbing onto something or gripping. So it's like grabbing on the doorknob or door handles or faucet handles, or when it comes to the gripping, when picking up something like a cup, glasses, or any item. For cleaning and doing housework, it can be challenging for people with arthritis because of the motions that are involved with mopping, sweeping, vacuuming. It can cause the joints to swell more and increasing the pain. With social activities, for the people that are dealing with discomfort, pain, stiffness from the arthritis, they have a tendency of isolating themselves with other people of the social gatherings because they don't want to deal with it. But there are ways how to cope with this, and there are treatments for it.
I will be discussing the treatment options for arthritis. So according to an online journal article from 2020, the common treatment plan for the management of RA. Upon initial RA diagnosis, non-pharmacological treatment is provided alongside the application of methotrexate and short-term application of glucocorticoids to reduce joint inflammation, resulting in remission/significantly lower disease activity rates in 30 to 50% of patients. As seen in the research, the manageability of this disease remains consistent without prescription drugs for patients who have been diagnosed early on. However, for patients who have later diagnosis or do not respond well to this type of treatment, will most likely do better with a pharmacological treatment. However, without persistent treatment, these issues will remain. So as a result, the people that do better, without drugs and are able to have consistent treatment plans are going to be more successful. 30% to 50% of patients will stop experiencing symptoms of this disease.